As we said earlier, Health and Human Services Secretary Robert F. Kennedy Jr. was at the center of that heated sanitary
under fire.
debate.
Yeah, under fire
sure.
from both parties over his highly controversial vaccine policies and the firing of the CDC director.
And of course, we are hearing from a growing number of lawmakers and medical groups accusing Kennedy of putting American lives at risk. ABC's Jay O'Brien joins us now live from Washington, D.C. with more on this. Jay.
Yeah, Shirlene, Tanya, Danny, this was perhaps the most contentious hearing that a Trump cabinet secretary has had yet on Capitol Hill.
Overnight, after a tense grilling of Health and Human Services Secretary Robert F. Kennedy Jr. on Capitol Hill.
Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem.
How can you be that ignorant?
President Trump standing behind his handpicked choice to lead the nation's top health agencies.
It's not your standard talk, I would say, and that has to do with medical and vaccines. But if you look at what's going on in the world with health, and look at this country also with regard to health, I like the fact that he's different.
Just last week, Kennedy ousting CDC Chief Susan Menares after less than a month on the job. Menares, in a Wall Street Journal op-ed, saying she refused to rubber stamp yet-to-be-written recommendations of a vaccine advisory panel, quote, filled with people who have publicly expressed anti-vaccine rhetoric. Kennedy saying she's lying.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
witnesses. Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. In a month, she became a liar?
Yeah.
A longtime vaccine skeptic, Kennedy has moved quickly to overhaul the nation's vaccine policy. The FDA narrowing the scope of people approved for the COVID vaccine this fall to just those over 65 and adults and children at high risk. Across the country, Americans telling us they're now confused and concerned about vaccine availability.
I don't know what the schedule is or what you're allowed to do or what illness you have to have in order to get it.
In that fiery hearing, Republican Bill Cassidy of Louisiana, a doctor, publicly expressing concern, reading Kennedy a letter from a worried physician.
There's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
And John Barrasso, a surgeon and the #2 Republican in Senate leadership.
And I've grown deeply concerned. The public has seen measles outbreaks, leadership at the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
Democrats calling on Kennedy to resign. And after that hearing, 3 Republican senators, all of whom were critical yes votes just months ago in Kennedy's confirmation, refusing to say they still have confidence in the secretary.
Do you still have confidence in him, Senator? His ability to lead HHS?
Do you have confidence in him, Senator?
Is there a reason you're not answering?
I have confidence in what the President of the United States is doing, and I will not second it.
And you heard in our piece there those concerns of those Americans who say that they are worried in some cases, they have questions. There's polling that backs that up as well. New numbers out of Reuters and Ipsos say that a majority of Americans, 55%, say they believe the country is on the wrong track with public health. Guys.
So much concern and a lot of confusion out of this. ABC's Jay O'Brien reporting live from Washington, D.C. Thank you. And obviously, it's about the science, right? At the center of this debate is the science. On Good Morning America, ABC News chief medical correspondent Dr. Tara Narula spoke about the importance of getting children vaccinated.
It feels like right now it is a chaotic situation. Like we are unmoored, there is no captain steering the ship. And I know there's a lot of misinformation and mistrust, but one thing that should not be under fire is vaccination and the public health story success that vaccination has been in this country. We know that it has saved millions of lives. We know that it prevents disability from diseases. So we forget, but polio can cause paralysis. Measles can lead to brain inflammation. So if you get sick, it can end up resulting in complications. We have vaccines for cancer. HPV and hepatitis. We need vaccinations to protect the vulnerable, the ill, the immunocompromised, children, right? So it is so important that we not forget the powerful impact.
Dr. Narula saying that this could have very dire consequences, taking away these requirements state to state. Stay with Eyewitness News and ABC 7 NY for continuing coverage of this battle over vaccines.